Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers, producer of Public Health on Call, and today, the future of the World Health Organization. Last week, President Trump announced that he would withdraw the United States from the agency that coordinates the world's response to health issues and emergencies. Stephanie Desmon talks to Dr. Judd Walson, chairman of the Johns Hopkins Bloomberg School of Public Health, Department of International Health, about both the obvious and more subtle ways this decision could impact health and security for the worse, not just globally, but here in the U.S. as well.
Judd Walson, thanks so much for joining me.
Pleasure to be here.
So today I want to talk about one of the big Inauguration Day executive orders signed by President Trump. This one about withdrawing from the WHO, the World Health Organization. While it wasn't a surprise, he tried to do this in his last administration, it's still causing a lot of shockwaves. And I guess I'd like to start by maybe if you could tell us what WHO is and why it's so important, and then what this really means.
Yeah, thank you so much. Yeah, I think it is really important to think about this from a place of starting with what does WHO do? What are the essential roles that it plays? And then if WHO were to be not here to support us, what would the alternative be and who would serve those functions? And I think that's a good framework to think about the impacts that this may have. So I think first, WHO has many, many roles, and I think I would divide them into the visible or the apparent roles that many, many people are very familiar with, and then maybe the roles that are less visible to many people. Because I think many of us are aware of the role that WHO plays in, for example, responding to and detecting emerging health threats, pandemics, and many of us saw that during the COVID-19 crisis. And so that is an important role of monitoring threats and coordinating response to emerging pandemics or diseases of importance. But there are many, many other roles that are important. One is that the WHO really gathers and evaluates data and information from all over the world to understand the status of health around the world and to be able to then detect what are emerging problems, both in terms of critical acute crises or threats, but also just in terms of trends in what sorts of health issues are becoming more important, have a higher burden of disease, and which ones maybe we're making more progress on, and we should continue to sustain existing efforts. The WHO also sets norms and standards and develops guidelines that help all of us around the world, including here in the United States, to deal with the various health threats and crises that we have to deal with. And that's, again, not only infectious diseases, but all sorts of health issues that we need to address. The WHO also provides, and I think this is a role many people don't appreciate, provides a number of commodities and goods to improve health around the world, including vaccines and drugs for many, many diseases around the world. And so that's an important point because that has impacts not only on people who receive those commodities, but also the supply chain includes many people in corporate America who are making those commodities. And so I think the impact of withdrawal from WHO is important there. The WHO also assists with humanitarian response, which has important implications for populations who are affected by those crises, but also has important implications for global diplomacy and the role of our humanitarian responses in improving global diplomacy around the world. And lastly, WHO provides very important technical assistance to governments and partners around the world to be able to respond to health challenges. And we are an important component. The U.S. plays a very important role and is a strong, strong member in terms of the technical assistance we provide.
Mm-hmm. I also understand we are the largest single funder of the WHO. Without the United States, what happens to WHO?
Good question. And I think, first of all, it should be acknowledged that without the United States, there will be important impacts, both because of the money, but also there are broader impacts beyond the money. So from a financial standpoint, we are the largest contributor, somewhere between 12 and 15% in 2022, 2023, I believe. And that's a large component. And this will very, very much strain the WHO. The WHO is already really, really struggling financially. And I think this will have very important impacts that will lead likely to the loss of jobs and the reduction of work and less ability to do the functions that we just talked about. I think it's important too to note that, if we think it's expensive to be part of WHO, just wait until we aren't part of WHO. That's where we're going to see the true costs. This will be incredibly costly for the American people, and it will be incredibly costly for the global community. And not just in the pure economic terms of our contributions to the WHO. The US has made incredible strides since World War II in developing a reputation around the world as a country that supports others. And that has important consequences for global diplomacy. We are known in the health space as a country that provides assistance to many, many countries. In fact, many countries for whom we have very poor diplomatic relations with, and we don't see eye to eye politically with, still reach out to us for support. And health provides an entryway for us to engage with countries, many of whom we may not agree with, and to have diplomatic conversations and other conversations that will not happen if that is lost. And that will have tremendous consequences for the security of the United States and for the long-term economic and political outlook of the United States.
So we saw the huge role that WHO played in the COVID pandemic. And so I think the WHO probably came to the fore of people's minds in ways it hadn't before, at least in the United States. And I'm curious what role we played and what could happen if we aren't there next time.
I will start by saying that the COVID response globally, I think, can be classified in some ways as a technical success. We had many technical breakthroughs, including the development of vaccines at a pace that had never been seen before, the deployment of drugs and vaccines to places that previously were hard to access, and we were getting, in some circumstances, getting those commodities to places very quickly. We had some consensus around how to approach the problem globally early on, but it was a tremendous diplomatic failure. And we saw that with the hoarding of vaccines by some countries and not delivering to other countries. We saw that with failure to be able to access data from China and other places around the origin of the virus. There were a lot of diplomatic failures. And so part of what the Trump administration is responding to are real criticisms of how things were handled during COVID. And, I think it's important to acknowledge that there were problems. Now, those diplomatic failures were not only at the WHO, they were broader than that. But, I think there are valid concerns about the way that the WHO operates in terms of handling large crises. There are also concerns about the failure to reform, which has been pushed on WHO for many years. And it is a large bureaucracy, and there certainly is room to reform. And concerns about lack of independence from sort of political pressures. And remember, the WHO is a consortium of many member states, all who have voice, and managing that is challenging, and that is a concern. And lastly, as you mentioned, there's sort of a feeling that there's a disproportionate level of investment by the US. And I think it's important to acknowledge those are all problems. But when we want to deal with a problem, rarely does walking away from the problem fix the problem. In fact, there's a great quote from a journalist that says that the only two problems that you can fix by going away are snow and adolescence. And, I can't remember who said it, but to paraphrase it. And I think that the problems that exist that need to be resolved are real, but the way to resolve them is to work to resolve them so that these functions can be performed. And I think many people's concern is that we do not have alternative mechanisms to deliver on those roles and functions in place. And therefore, withdrawal will leave those functions unfulfilled. And so I think it's very appropriate to talk about how we reform a system that needs to be reformed in some ways. But withdrawal from this system is likely to cause enormous strain on the global community. And ultimately, the global community will suffer. The global community will have poorer health. And we as Americans will suffer. And we as Americans will have poorer health.
I mean, that's a part I think that gets missed in a lot of this, is that this really impacts the health of people, not only around the world, but also in the United States.
Absolutely. And, I was I was on a call actually this morning with WHO colleagues and with colleagues around the world providing assistance as is part of this mandate to think about what are the priority gaps in our understanding of further reducing childhood deaths around the world, and really coming up with a list of what should we be prioritizing in terms of areas that need to be addressed to further reduce deaths. And that's important if you're living, somewhere in a low-income setting where WHO may play a critical role in helping to develop guidance, et cetera. But it's important here too. I think many of us in our families, amongst our relatives or our friends, have dealt with, for example, prematurity and having a baby born premature. And, that's a high risk period for a baby. And those who've experienced it know that. And where do these guidelines come from? How do we know what the best interventions are to address that problem? That comes from data from around the world that has been collected and interventions that have been tried to see if this can improve survival or reduce the level of morbidity in children who do survive. And we benefit here at home from the work of the WHO in real ways. And I think that's what is sort of being missed in this dialogue, is that this is not only about what we do for others, as important as that is, it's also about what we do for ourselves.
Now, this would take place, I guess, within the next year is the idea?
Well, yeah, my understanding of this is that, in fact, the withdrawal sort of happens immediately, but that there is a commitment of 1 year or a period of 1 year in which that financial commitments remain. And so I think, and I hope, and I think many of our colleagues hope that over the next year, before the expiration of our commitments, work can be done diplomatically to try to figure out if there are ways to work with the administration to really come up with concrete plans for addressing some of the real concerns that have been raised, but to do so in a way that strengthens WHO and doesn't weaken it, and allows us to perform those essential functions that are important for our health. I think that really is maybe an opportunity. I have to say I'm a bit pessimistic that, that is on the table, but I think I still have some hope that we can get there.
WHO has helped do incredible things across its almost 80-year existence. It helped us almost eradicate polio. It's helped us get more vaccinations to people. And it also plays this key role, as we've seen recently in outbreaks. My question is, we are currently dealing, at least in the United States, and I know of other places around the world, with a new concern, the H5N1 bird flu situation. If we don't have, in real time, what does that look like if we don't really understand what's going on everywhere?
Yeah, no, it's a huge concern. And I think people just need to sort of back up and envision what this would look like. So let's take the hypothetical emergence of a new disease somewhere in the world. Let's pick somewhere on the Asian continent, just for the purpose of, a location, that in a small country somewhere in Asia, a new disease emerges. Now, under the system in which WHO is strong, and we're part of that system, the data that suggests, wow, there seems to be a spike in new fevers and a respiratory illness among this couple hospitals in this one area of the country, that would be alerted to the local WHO office, country level office, go up to the regional office. There'd be an assessment whether this seems like something that seems out of the ordinary. If so, advice would be provided to the country about what sort of diagnostics might be employed to identify the cause of that outbreak. There might be, depending on the need, some sort of capacity sent to the country, whether it's people to help advise or equipment to make diagnoses, whatever that would be. And pretty quickly, hopefully, we would be able to identify, is this a virus or a bacteria? If it's a virus, is it a common virus that's just changed? Or maybe it's not changed, it's just a seasonal abnormality or pattern that we haven't seen before? Or is this something new? It's a threat, it's an emerging disease. That would all happen, and those data would be shared up the chain all the way centrally to WHO and then shared with the member states. There'd also be a discussion involving those member states about whether that's a threat, what kind of a threat it is, what sort of response that should be. And currently, the U.S. plays a critical role in all stages of that, in assessing the threat, evaluating whether a response is warranted, what it should be, and then helping to organize that. Now let's take a step back and say we're no longer part of WHO. This disease emerges. The same thing happened. We have no idea. There's no communication that anything's happening. The U.S. has no visibility. We have no access to the data. At some point, maybe people in this system decide it's not a threat. We've had no voice into whether we agree it's not a threat. We're not part of that decision making. We don't hear anything about it until, boom, all of a sudden it was a huge threat. It's too late. Or let's say that they decide it is a threat and they start mobilizing all sorts of resources. Well, maybe we didn't believe it was a threat. And in fact, we would have thought otherwise. Then let's say that they do think potentially it's a threat. We have no voice in what the response should be, how containment should happen, what sorts of air travel restrictions might happen, what sorts of treatment strategies might be employed. All of that is now, we're not part of that discussion. We have no access to the data. We don't have access to the sequences of the actual pathogen to help us develop a response in terms of vaccines or otherwise. All of that now becomes a black box. And people say, well, can't we still have country to country, engagement? Certainly we would do that. Well, it depends. It depends. Is that a friendly country or is that not a friendly country? Is that a country in which we have active collaborations that are going to be part of discussion or not? Do we really want a system that's dependent on whether or not we like you and whether you like us in terms of our ability to collaborate on something of global importance like a potential pandemic? And that's really what we're talking about, is the potential for the inability to be part of that decision-making process and understand what's happening in the world around us.
Judd Walson, thanks so much for joining me and giving us that terrific perspective.
Thank you so much.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.